Module 6. Tissue reaction caused by parasite to the host. Tissue reactions caused by parasite to the host. Learning objectives. This module will inform the student about the effect of parasite on the host, or in other words, the injury and lesions inflicted by parasite during its invasion, establishment and development in the host. Tissue reaction caused by parasite to the host. Introduction. Parasite affect the host by two major ways. They may cause direct injury due to the process of entry, establishment, feeding and multiplication in the host, and indirectly by transmitting pathogen that may kill or affect the well-being of the host. Effect of parasite on host. Direct effect: injury during entry of parasite, destruction of tissue during migration of parasite, injury during establishment and feeding on host, loss of blood and the associated animal anemia, mechanical interference, occlusion and pressure atrophy, pathological changes, hypertrophy, hyperplasia, neoplasia, metaplasia, competition for host nutrient, effect of allergen, toxin and secretion, immunological reaction. Indirect effect: transmission of pathogen, parasitic castration, immunosuppression, growth retardation, reproductive failure and reproduction loss, injury during entry of parasite. Injury during entry of parasite. Certain parasites cause direct injury to the host during the process of entering the host. The hookworm, Encyclostoma species, Buenostomum species cause injury to the cell and underlying connective tissue when they penetrate the skin of the host. Cercaria or certain cystosomes cause dermatitis while penetrating the host skin. Loss of blood and the associated anemia. Some parasites suck blood, hookworm, barbel polworm, mosquito tick, etc. from the host, resulting in anemia. Though quantum of blood impeded by insect and tick and the resultant blood loss may not impair the health of the host, but the quantum of blood impeded by some species of ailments such as barber's polworm, hookworm and redworm of equine is immense and may prove fatal to the host. Homunculus contractus in large number may bleed the animal, cause severe anemia and mortality in lamb. Heavy infection with tick can lead to severe anemia in animal. A single adult female tick is reported to suck around 0.5 to 2 ml of blood, and therefore if an animal is heavily infected with ticks, substantial blood loss may occur. Development of edema in host. Loss of plasma protein, especially albumin, hypoalbuminemia, result in edema where fluid accumulates in the submandibular space between the mandible, which is commonly known as bottle jaw, or in the peritoneal cavity, ascite, and thoracic cavity, hydrothorax. Exchange of fluid between blood and interstitial space is controlled by hydrostatic pressure and plasma colloidal osmotic pressure. If the hydrostatic pressure is high, fluid will leave the blood vessels and shift into the interstitial space. On the contrary, if colloidal osmotic pressure is high, then fluid will be drawn into the blood vessel. The plasma protein albumin balance these two factors. Loss of blood result in hypoalbuminemia, and as a sequence, colloid osmotic pressure is reduced and hydrostatic pressure is increased. This results in seepage or fluid from the blood vessel into interstitial space, resulting in edema. Edema is commonly seen in parasitic disease where loss of blood occurs as in hemococcus, hemocosis, fasciosis, ampistomosis, etc. Change in protein metabolism and mineral level. Change in protein metabolism and mineral level. Change in protein metabolism and mineral level commonly occurs in parasitic infection, especially in helminthic infection. Reduced level of amino acid incorporation in muscle protein resulted in reduced weight gain and weight loss. Reduced incorporation of amino acid into protein by wool follicle affect the wool quality. The wool of helminth affect sheep become brittle and wither away. Mineral deficiency affect the growth rate, sin, skeletal size, bone size, ultimately determine the capacity of growing animal to accumulate muscle. All these result in reduced weight gain, reduced wool growth, and reduced milk production in infected animal. Destruction of tissue. Many parasites during their course of development undergo migration into the tissue of host. Example include immature stage of liver fluke that migrate in the liver of cattle, sheep, and goat causing traumatic hepatitis. Larvae of Toxocara canis, Toxocara gatti, Toxocara vitilorum, and Ascaris some migrate through liver and lungs, inflicting physical damage, especially to lung. Trichinella spiralis larvae cause severe myositis as they migrate through the muscles of their host. Module 7. Tissue reaction caused by parasite to the host. Tissue reaction caused by parasites to the host. Learning objective. This module will continue to inform about the effect of parasite on host. The tissue reaction caused by different parasites during establishment and feeding on host. Mechanical interference, pathological change, effect of secretion or excretion, and the immunological reaction of the host to parasite resulting in immunopathological regions will be taken up in the chapter injury during establishment and feeding. Fluke tapeworm and acanthocephalan armed with sucker hooks and spines cause irritation to the mucosal surface of intestine. Immature stage of amphistomas ingest plaques of mucosal tissue as they feed. Pitting lice such as Bovigola bovis browse on the epidermis and cause intense irritation, inflammation, and leakage of serum from damaged skin. Tick also cause inflammation and leakage of serum from damaged skin in sensitized animal. Sarcoptes might persist and burrow into the skin of animal leading to irritation, itching and inflammation of the skin characterized by keratinization, thickening and wrinkling of skin. Mechanical interference occlusion death due to intestinal obstruction by parasite is common. Example ascarid and tapeworm. Occlusion of bile duct by liver fluke obstruct the flow of bile resulting in icteria. Adult filariates logged in lymphatic duct cause aggregation of connective tissue that result in blockage of lymph flow and edema in hose. Gapworm block the air passage causing dyspnea and asphyxia in fowl. Lungworms such as Dictochelus viviparus cause block of bronchi leading to atelectasis and emphysema in lung of cattle. Occlusion of blood vessel with thrombus, as in the case of Strongylosis vulgaris in horse, may prove fatal if the coronary artery or bronchocephalic trunk is involved. In hemoprotozoan disease such as babesiosis and malaria, protozoa infected erythrocytes get trapped in the microcirculation of organ, impeding blood flow, resulting in hypoxia and necrosis of tissue. Pressure atrophy. Pressure upon organ by larval stage of parasite, especially those of tapeworm, result in atrophy or distortion of the organ involved. Coinuras cerebralis, the larval stage of the tapeworm tinea multiceps, exert pressure on the brain of sheep, causing the condition known as gait or stagger. Similarly, the larval stage of Echinococcus granulosa, some hydrated cyst in various organs, especially in liver and lung of animal and man, that cause severe problem in intermediated host, especially human. Pathological changes. One of the effect of parasite on host include changes in tissue that are affected by the parasite. Some parasites cause chronic inflammatory reaction, resulting in fibrosis and formation of nodules in the inflamed tissue. In Ascaris, some infection spot of white fibrous tissue, milk spot are formed in the liver of affected piglet. In sensitized sheep, larvae of Esophagostomum columbianum are encapsulated within nodule, owing to inflammation and infiltration of eosinophil and foreign body giant cell to cause the condition known as pimply gut. Larvae of marble fleas from cyst in the back of cattle and develop within it until ready to leave the host for pupation on the ground. Hypertrophy. Hypertrophy commonly occurs in all intracellular parasites. For example, in coccidiosis, the intestinal epithelial cells are markedly enlarged. Hyperplasia. Hyperplasia is associated with some parasite, as in liver fluke, that cause increased division of cell lining the bile duct, resulting in thickening of the bile duct. Neoplasia. Another tissue change in neoplasia, which is associated with Spirocerca lupi, the gladworm of dog esophageal nodule, transform into a granuloma and later into sarcoma, are common in S. lupi infection. Metaplasia. Infection caused by the lung fluke Paraconium westermani. The parasite is surrounded by epithelial cell and fibroblast cell in lungs. This is a classical example of metaplasia, where one type of tissue transforms into another without the intervention of embryonic tissue. Effect of secretion and excretion. Ticks secrete a toxin that causes the condition known as tick paralysis in mammals. 11 hard ticks and one soft tick is associated with tick paralysis. Tick paralysis is characterized by acute ascending flaccid motor paralysis. Release of parasite internal antigens result in anaphylactic shock in some cases. Metabolic product released during erythrocyte destruction in malaria cause febrile response in host and toxins or metabolic products secreted by trypanosomes cause injury to the host. Host immune response to egg of Cystosoma nasally cause nasal granuloma in cattle. The nodular worm of sheep and goat Esophagostomy columbianum may cause calcified nodule in sensitized host, impair digestion and absorption of nutrient in their host. Thank you.